esteemed partners, distinguished guests, it gives me great pleasure to join you at this partners meeting to affirm our individual and collective commitment in the elimination of mother-to-child transmission of HIV and syphilis. I'm especially pleased to be speaking with you because I have witnessed the passion and the enthusiasm you have shown towards this vision. As partners, we remain inspired to do what we can to realize a world free of HIV and syphilis transmission to newborns, a world with zero maternal deaths. This is why the government of Kenya has committed, through universal health coverage, to scale up its efforts to improve access to HIV treatment, to improve the health and well-being of women and children living with HIV. As patron and champion of Beyond Zero, our overall mission is to end unnecessary deaths of women and children and to eliminate new cases of HIV infections from mothers to their children. Since I began my own journey in 2013 with the Beyond Zero initiative, we have depended on partnerships with the national and county governments and other health stakeholders. It's thanks to your drive and commitment that we have already delivered 52 mobile clinics across Kenya. More recently, we have extended our resolve to increase access to healthcare through the Beyond Zero medical safaris. Our work is driven by our understanding that access to decent and affordable healthcare plays a huge role in saving lives. So far, we have conducted successful medical safaris in the regions of Nyanza, North and South Rift, Central and Nairobi. But as we know, the work is not yet done. There are still significant gaps which affect Kenyans, particularly underprivileged women and children, which need to be urgently addressed. During the Beyond Zero Summit 2017, when I launched the Kenya Framework for the Elimination of Mother-to-Child Transmission of HIV and Syphilis 2016 to 2021, we celebrated our achievements. But the report also drew our attention to issues where we need to focus our attention in order to fast-track our activities in readiness for validation. Esteemed partners, this past year has been particularly difficult due to the COVID-19 pandemic. We have lost many of the gains we had made. Concern has also been raised about the increase of new HIV infections among girls and young women, many of whom unknowingly pass on the virus to their children during pregnancy, delivery, or breastfeeding. This is why we're here today, to reaffirm our solidarity and commitment to hasten our efforts. We are here not only to share experiences as experts, but to build consensus on how we can fast-track the implementation of the Kenya EMTCT framework and garner momentum towards our national goal. I applaud the innovative implementation approach adopted by counties through the county business plan model. These plans have formed the blueprint for sustainable and timely implementation for each county to meet their specific and unique EMTCT circumstances. I'm convinced that our successes rely on harmonized efforts from both the public and private sectors. I believe that our targets are achievable because of the solid partnerships we have built with you. You have steadfastly stood by us over the years, and we welcome new partners to join our cause. So far, with your support, we have successfully launched 11 county business plans. It's my hope that we, as partners, will commit to resourcing and supporting the remaining county governments on their respective journeys. So I thank everyone who has made today's partners meeting possible. Thank you for sparing your time, for sharing your expertise. At the end of this meeting, we shall launch a joint partner commitment towards the acceleration of the attainment of Kenya's EMTCT targets in 2021. I wish you fruitful deliberations and look forward to reading your resolutions. Thank you, God bless you, and stay safe.
So asanteni sana. When we came in, I saw it was from 7:30 to 2 o'clock. That's why I didn't have much hurry to hurry because I think there must be lunch. I'm looking at Eva. And now we are kindly requested for us to remember this day. Let's go for a photo. Just leave your things, we go for a photo, then after that we go for lunch, and maybe we pray so that after that we break for lunch. And
we have listened to quite a chunk. Some of us are angry that we are not where we wanted to be. But I think most importantly is that hope is not lost. We have done it before and we can do it now. So my presentation or my remarks is just to allow us to remember that we have actually done it before. Allow me just to look at a reflection of our historic perspective, what we did. We started this journey in 2011. By 2012, Kenya was among the first countries to have a framework in place. And in that framework, we said we were going to catalyze leadership, we were going to advocate for accountability, we were going to demand for social mobilization that creates demand for services, we were going to accelerate the implementation of programs and strengthen the health system. We were very lucky and privileged, as you heard from one of the presenters from WHO. Kenya was one of the countries, Her Excellency, that has been known globally because of your efforts to come and leverage leadership in this country, for your commitment to champion, and most importantly, to provide leadership that has never been seen anywhere else in this world. We really take this opportunity to sincerely thank you for that commitment. So this particular framework for the First Lady that really helped us strengthen and promote leadership across the country was a key strategic initiative that did come into this program. So what did we do with the First Lady? The First Lady initiative, most importantly, not only allow us to have political championship, but also the commitment through the Beyond Zero was highlighted as one of the ingredients of success. We also had technical leadership and accountability for results. So we aligned ourselves along the First Lady championing up there, but we also had champions within the technical teams that were working side by side. We also had effective coordination and we monitored intervention, the county-level technical support and political momentum that Your Excellency, you personally visited the 47 counties. I'm sure, I don't think there's any other leader in this country who has gone to every single county. And for that, we really thank you for that commitment you did. We also had the Kenya Mentor Mothers Program. We've had a lot of people allude to the fact that we need to have community engagement. In terms of leadership, which is my focus today of my discussion, Your Excellency, your leadership, and this is what I shared with Her Excellency in Botswana, and she said, can I go to Kenya tomorrow? I shared with her the fact that we had a very simple, realistic framework, and we had your commitment to action. You did catalyze action within the technical areas. There was homegrown solutions, and local resources were invested. And most importantly, there was a movement that was generated, and this movement encouraged social dialogue. And again, you did influence investments. I hope you can remember this. This was the first day just before the launch of the first framework, and we got the blessings from the children in Mombasa. And this also did move forward to influence the first county we did visit. We went up to the marathon. You influenced quite a lot of people in terms of what you did. The actions of marathon were not limited just to the national level. We saw it across the entire country.
Your Excellency, allow me at this juncture to invite a few other partners present in the room to come and make their physical pledges. And I'll start with Dr. Samuel Kinyanjui.
Additional support to 8 other counties in normal EMTCT activities at the county. These are the counties of Kwale, Taita Taveta, Makueni, Nairobi, Mombasa.
Ladies and gentlemen, Your Excellency, First Lady of Kenya, Mama Margaret Kenyatta, on behalf of the Kenya Red Cross Society, allow me to make our commitment to supporting EMTCT through human rights, gender engagement of communities, and activities for persons living with HIV and AIDS, which will support in 28 counties, working together with our local partners. The counties in question are Bungoma, Busia, Garissa, Homa Bay, Isiolo, Kajiado, Kakamega, Kericho, Wajir, Kiambu, Kisii, Kisumu, Kitui, Laikipia, Lamu, Mandera, Marsabit, Meru, Migori, Nairobi, Nakuru, Nandi, Siaya, Tana River, Turkana, Uasin Gishu, and Vihiga. We look forward to fruitful collaboration for this. Thank you very much.
And also review progress and develop 2022-2029 EMTCT framework, including pediatric TB and nutrition interventions. Thank you.
The UNAIDS country director to make their commitment on behalf of the UN Joint Team. Over to you, Dr. Medine.
Thank you so much, Dr. Amy. Good afternoon, and Your Excellency, Madam Margaret Kenyatta, the First Lady of the Republic of Kenya, Chief Guest, Dr. Mwangandi, and all protocols observed. On behalf of the UN family and my own behalf, allow me to take this opportunity to thank Your Excellency for your leadership and championing maternal, adolescent, and child health, and more specifically for your unwavering commitment to the dual elimination of mother-to-child transmission.
We've had the commitments. We know there are many more who wanted to present their commitment today, but we shall present these commitments to you after we receive all of them. At this juncture, we would like to invite the 2 other CC's members that are with us today so that they are able to present this commitment to the Chief of Staff.
To the cameras, yes. Present the commitment. The commitment is being presented to the Chief of Staff and also the Madam CAS. Thank you very much. Let us give them a round of applause. It has been wonderful. Remain there.
On behalf of the Office of the First Lady, it's my pleasure to welcome such a distinguished audience. I thank everyone attending physically as well as virtually for making time to attend this meeting to discuss an extremely important agenda: the elimination of mother-to-child transmission of HIV and syphilis. I also thank the Ministry of Health, the National AIDS Control Council, and the National AIDS and STI Control Program, NASCOP, for drawing our attention to the urgency of a renewed commitment towards this goal. Together, we have a collective responsibility, as well as a tremendous opportunity, to transform the lives of mothers and children of this country. As partners, we have made significant impact and investment. although with the coming in of the COVID-19 pandemic, we may have made a few steps backwards. Beyond Zero, through Her Excellency the First Lady, has, since 2013, continued to advocate, provide leadership, and invest resources in order to respond to our national goal of zero maternal and child deaths. The main goal of this meeting is therefore to accelerate our progress. To achieve this, we will renew our individual and collective effort to implement Kenya's EMTCT framework. In addition, we should note that community engagement greatly advances efforts towards the EMTCT of HIV and syphilis, so we need to make a concerted effort to reach our target populations wherever they are. Once again, I welcome you and thank you for your attendance, and I look forward to a very fruitful meeting. Thank you.
I am so glad that we are here in this room this morning because we are here to form a partnership and create commitment that as we get out of here, every child born from a HIV positive mother has the hope that they will turn HIV negative, that they won't have the story of living knowing that at some point I'm going to get okay, but then they realize at some point that they have to take medication for the rest of their life. We have to end that. We have to make that commitment before we get out of here that every child born this year, who will be 10 years in 2031, will not be born with HIV. Because we owe the children of this country that. We cannot let them be born with HIV. And we need to go down to the community. We need to stop assuming that community is a small village with an unpronounceable name. It is me and you. And it is me and you to reach to the woman out there who does not want to go and get tested for HIV. It is me and you to go out there and engage with the community health volunteers, with the mentor mothers, because they're the people who these HIV positive women call in the middle of the night. They're the ones who they ask, hey, my child is crying, what do I do? Is that if I breastfeed them at this point, are they going to get a HIV infection? My viral load has become detectable. How do I handle this? It is that CHV that we need to talk to. It is that CHV that we need to motivate and encourage them that even at 2 a.m., they are at the beck and call of these mothers, because those mothers need information. Most of them are worried. They are worried, I am pregnant, I'm going to give birth to a HIV positive child. I can't give birth to a HIV positive child. What do I do? Let us make provision of ARVs available for these mothers, because we can speak all of the things that we want to speak, come up with very nice documents, but if we don't give ARVs to these women, they will not become undetectable. If they're not undetectable, they're putting the child at risk. And we don't want these children to be born with HIV. So let us start by ensuring that there are commodities for these women. Let us engage with community leaders at the ground, because these are the people who are going to champion for the messages of HIV prevention, for the messages of dual testing, for early ANC visits. These are the people that we need to hold hands with. We need to give them the information. Tell them if a mother is undetectable, they are able to give birth to a HIV negative child. Let them make this message so simple that that mother in Wajir is able to understand. We say a lot, I do say a lot about you equals to you, and people are like, if you have HIV, you are definitely going to infect someone. But no, we need this message to reach every person out there. Because if this message does not reach everyone, then we will still, 10 years from now, different people might still be seated in such a room discussing EMTCT, and we don't want that. We need to put a target that before we get out of here, the people at the ground are engaged fully. We need to bring psychosocial support for mothers who are HIV positive, because these women give birth, go through postpartum depression, and they are not able to take care of their children. They are not able to take care of themselves by taking their ARVs. They give up. The other day I was talking to a young woman who has a 2-year-old right now. The child is HIV negative, but she told me that there's a point she looked at that child and asked herself, why do I need this child? Why did I bring this child to earth? When a mother reaches that point, it is definitely a point where she cannot hold it together anymore. Mothers are created, and people think that they should hold everything together. But there is a point they reach where they also need that support. Let us create mental health programs that have that are actually training the mentor mothers and the CHVs at the ground to be able to support these women psychologically. Because even if we give this responsibility to healthcare workers, they are also overwhelmed. Sometimes they might not be able to reach each and every person. But the CHV has their 10 houses. They know that in these 10 households, I am able to support these women. I am able to encourage them to start early ANC support. I am able to encourage them to take treatment. And I'm able to tell them that, hey, this is why you need to take your ARVs, and this is why you need to stay adherent. So as I finish, I am urging each and every one of you here. I believe that we are all here because we are here to make our own commitment. And that commitment will start by us saying that going forward, we are going to have 0 new mother-to-child infections. That is our commitment as we step out. So by a show of hands, I know the online people might not be able to lift their hands, but by a show of hands, who here is committing that as we go out, we owe the children of this nation 0 new HIV infections?